So what happens today is wearing glass is normal. Not wearing glasses is considered something abnormal.
Why don't ophthalmologists do LASIK on themselves? Can you shed some light on that?
Now that myth is just buying an over-the-counter drug and say that it'll work wonders. It's not going to happen. That means a child who has who's eating a lot of sugars may have a low level of dopamine. Your fourth standard or fifth standard photographs, 2 or 3 people will be wearing a glass. In at least he's much younger than me, but in my class maybe 2 people, and he was like the star, like he was the only one who wear a glass. You go and look at your kids and you ask them for a photograph, except for 1 or 2 kid who looks a little abnormal, everybody wears a glass. People tell me, oh, just a glass, but having glasses is not true vision. So 1 in 3, or sometimes they say 1 in 2 in Asian population will be wearing glasses. We believe that the diabetes is only one which is sugar driven. I can start from dry eye, myopia, retinal conditions, blood pipe hypertension. You look at muscular dystrophy. Housekeeping mechanism of the eye is altered in dry eye, and especially when you're working for long hours in the screen. Dry eye, or it's just not about lack of tears or excessive tears. It's about your quality of your ergonomic workplace, how you sit, how you work, and how you focus. We are now seeing that there is a different level of change every cells behave when you stimulate with blue light.
So, learning to use a fundoscope properly should be a non-negotiable skill.
Absolutely.
Every medical student, every MBBS student should know how to do this.
So the faith in healing is a very, very important aspect of medicine.
Hello and welcome. Today we are sitting with Professor Dr. Rohit Shetty, a clinician and a translation scientist at Narayan Nethralaya. In today's conversation, we're going to take a deep dive into the eye, everything you need to know about taking care of your eye and the rest of your body. Let's go. Thank you, Dr. Rohit, for being a part of this conversation. There are a lot of things that I want to ask you about ophthalmology, about the future of eye care. But I want to start off with something that is on everyone's mind. Screen time is everywhere. So adults, kids, adolescents, everybody is on their screens all the time. So just to put things at rest, is excessive screen time harming our eyes?
Absolutely, without any doubt. If you look at the evolution of a human being, we started with the hunter-gatherers. We were like monkeys. Then we started Homo erectus. So as evolution started changing, our body started adapting to our functions, what is necessary to survive. Today, to survive, you need the screen, some for the screen. So from the body from a certain level of tolerance to a few things, we suddenly in the last 2 decades, the transition from one model to the other was extremely drastic. And bodies don't tolerate those change. We are now seeing that there is a different level of change every cells behave when you stimulate with blue light. The blue light, if you put our cells in an experimental model and you simulate with blue light with different wavelengths of light, the cells alternate to different level of stress. That means that the light what emits from your screen is just not the light which is the visible spectrum light. It has a certain wavelength which has an impact on different segments of your eye. Okay. And there are a lot of new diseases which we started seeing. Dry eye is one where your cells of your eye responds to different stress. Stress is inadequate blinking, stress of light, stress of focusing on those pixel images you call words, and the amount of stress you put on it. What happens is the stress on those cells makes to release or the cells to die. And when the cells die, they bring in a lot of unwanted materials out there. It's like a burst of a cell has All the cells, whatever has inside in it, gets secreted. And if there is nothing to clean it,
Right.
then what you have is it's like your kitchen with nobody to clean it, and you keep dumping the same used plates. It stinks. So what the unique work we did many years back is there is a mechanism of housekeeping in your body, that the mechanism is called autophagy. It's a word. Autophagy is responsible for everywhere: cancers, Alzheimer's, Parkinson. We were one of the first group to say that the housekeeping mechanism of the eye is altered in dry eye, and especially when you're working for long hours in the screen. So what does it mean? Your cells die, but there is nobody to clean it. That's when we started looking at what are the ways in which we can improve this housekeeping mechanism. What are the mechanisms to improve autophagy? The autophagy has been implicated in cancers to many other diseases. 2015 or 16, the Nobel Prize was given to man who described autophagy from Japan. So we started looking at what happens in the botanical kingdom when you cut a leaf or you take a branch out. How does it regenerate? This secretes, certain plants have a self-regeneration mechanism which cleanses. It's like your inherent body's uh, health mechanism to improve the life of those dead leaves or cells. And those things, we call it as trehalose. So what we did was we introduced a trehalose-based component, which is one of the components of regeneration revivals, and we introduced in the lubricants, which is one of the new way of looking at how we treat the dryness. So the word dry eye, sometimes you assume that we just go pick up any lubricants, any tablets, anything from the, just put it, it's just not water. In 2025, dry eye is altered cell mechanisms, and that needs to be addressed. And that's why our thought process of dry eye has to be relooked at it completely. So it's not like before. The changing to newer age diseases needs to look at from newer magnifying glasses to figure out what pathways are altered. So apart from all that we know about dry eye, the amount of screen time, blink rates, looking at 20 feet and all that, we also have to address how you treat them, right, in today's context. Just buying an over-the-counter drug and say that it'll work wonders is not going to happen.
That is fascinating because I'm already looking at dry eyes differently from this 10 minutes of conversation. You said that light hits your eye, and you said blue light affects your eye differently.
Yes.
When you talk of dry eye, you are talking about the conjunctival layer, the outer layer,
Corneal layer.
the corneal.
Cornea and conjunctiva both, along with goblet cells, which are the cells which are responsible for bringing in healthy tears. So when you say dry eye, it's not that there's no water in your eyes. There is water. It's like you have a tank which has clean water and the tank has a muddy water. Dry eye has got both. You may have a tank without water, or you may have a tank with lot of cytokines, inflammation molecules filled with it. It's like if it's there in your eye, it's fully watering. Some people say, I keep watering all the time.
Right.
But my eyes are not happy. That means your whole tears is filled with all kinds of substance which should not be there.
So I want to take it one level deeper into the eye. So light hits the eye, it will affect the cornea like you described. It goes in, then you have the lens. How does excessive screen time affect the lens?
See, what happens is, for example, I'm looking at you. The lens, like your cameras, it has to focus in. And then when you look at the distance, it goes back.
Right.
This is called the accommodation. When we are young, this happens at millions and millions of times, and we don't face it. When you are in 35, 36, 37, earlier it used to 45, 50 years, where the accommodation lag starts. Because of excessive screen time, that people coming to me now at 35 have already started showing the accommodation lag. That means I'm looking at you and I look at him. It takes a few seconds for me to get that focus. It's like when you're focusing your camera, it takes a few time for you to get that focus. Imagine, I feel that at 36, 37, we are having that problem. What you should have had at 45, 46. See, what happens is this excessive focusing, then what happens? You have to put in efforts. The putting the efforts happens not only with the eye, but your body's, the structure in which you sit. For example, you go back like this, then you see unknowingly to you, you tilt your head and you do this, you do that. You are trying to focus on that thing with your entire muscular system. What happens at the end of the day? You feel tired. You feel that ergonomic challenges happen. Then they get a fancy chair where you feel that you don't, your back is okay, but still you're putting that efforts. So when I get people who comes to me with this, I ask them, show me how do you focus on something? Just if this is your phone, the first thing they'll do is they go back, do this, do this. This is all involuntarily. So what happens is that changes the whole dimension about your whole musculoskeletal system. And then at some point of time, you also start getting those dark circles, because when you want to focus, what do? You do like this. And every time you squeeze, the pigments and a lot of other blood vasculature changes happens. So today you see those young people, they keep asking me, just get me is there a wonder drug for dark circles? I tell them that it just depends on the way you work. They don't believe, because work is eye and this is, and you can, then if you ask them to show me how they work, they're always squeezing. When you squeeze, what happens? Your muscles, your whole, you get those wrinkles out here over time. So aging is very faster. So it is not one component, it's just multiple components which attracts, and you have those challenges. So dry eye, or it's just not about lack of tears, of excessive of tears. It's about your quality of your ergonomic workplace, how you sit, how you work, and how you focus. And for that, we have to be very active in the kind of therapies we give as a doctor. We can't give what worked 25 years back, what worked 10 years back. Today, we have to use much different type of medications.
Right.
We don't use steroids too much, but we have non-steroidal immunomodulators, we call, where these immunomodulators work like steroid. Cyclosporin is one of them. When we had cyclosporin, people Google cyclosporin, oh, this is a cancer drug. So cyclosporin here is much diluted, and it's been proven for the last 25 years. We can give it on children at much higher dose. The dose of cyclosporin doesn't reach anywhere. And cyclosporin, if the doctor is giving you, a lot of patients have the myth that they don't want to take it.
Right.
So please do not get into this. It is a very safe drug. It's safer than a steroid. And these cyclosporin drops, it reduces that muddy water, which is cytokine filled. That means those water which has loads of cytokines, it just makes it cleaner. And we also have these new molecules I told about, autophagy, which cleanses the cell to regenerate, so that the dead cells gets cleaned and the new cell starts growing.
Brilliant.
And there is option today of people can take omega-3 fatty acids, which is again has some role, but there's a Lancet paper with New England Journal of Medicine paper which said that there is probably not much of effect, but it's debatable. We also have now option of resveratrol, which is a new molecule, which is from the, this is the red part of your wine. But, you need to have gallons of liters to get the same effect. Now you have in a tablet format. It also helps to regenerate a lot of these cells. Then there are work of curcumin also has an impact. Vitamin D, the sunlight has an impact. God has given vitamin D receptors on your cornea. It can produce vitamin D without the need from sunlight. So I believe that if an evolution or the God Almighty has given something, it means it has a role. So there are a lot of new studies show that the vitamin D is a hugely important factor in the maintaining the ocular immunological system and on the ocular surface.
So people associate eyesight with vitamin A. Like I have grown up hearing that eating carrots will lead to better eyesight. But now this vitamin D angle is interesting. Do carrots actually lead to better eyesight?
Uh, Not the carrots. Uh, Man, it's. I would not want to break the bubble here, but what I feel is I want children to eat good, healthy carrots because it's health. But if you associate that is going to make a dramatic change in your quality of vision, that might not be true. And and I remember my we had the first dog, and somebody told his name was Rover, and my wife said that somebody said these kind of breed of dogs have very poor vision for some reason. So she used to give him this much of carrot and used to nicely munch it. I didn't see a great improvement in his vision. But what I'm trying to say is any vegetable is healthy. All vegetables are healthy. There's nothing which is not healthy. That has, if not for vitamin A, it has omega-3 or one of those factors.
Or fiber.
But fibers, absolutely. But what is very important is vitamin D. So before you go to a doctor, if you're suffering from any of these things, just get your vitamin D, and you will see that if it's deficient, you have to take appropriate actions. And our team has published close to around 28 papers.
Yeah.
One of the largest series of vitamin D related ocular surface work has been done by a team. So we have realized the power of vitamin D in health, especially ocular health.
Incredible. Because even in neurology, vitamin D is proving to have such a major role in diseases from
Absolutely.
multiple sclerosis, autoimmune diseases. So let's go further into the eye. So we've talked about under the eye dark circles, we've talked about dry eyes, we've talked about the lens. I want to touch upon the lens a little bit more in children. So you mentioned at one point when we were talking that 1 in 2 children across the world will be wearing glasses. That is a shocking statistic. So how does that happen?
Again, I like to go back to the human evolution because that's the way we can understand what's happening to us. We were once our vision. We had the same kind of vision what your predators have in the night because we were hunting in the night. So our vision, we have rods and cones. The rods are for the night vision, the cones for the day visions. So we had the same amount of it because we were actually at one point of time as good as a tiger or a cheetah in the dark. But evolution, maybe we became lazy, but we just started doing work more in the morning because of challenges in the night. So we adapted to the new thing. And over time, we started adapting to books. Books were no pixel, and books you had it. You could keep the book here or here. You could adjust that thing. But suddenly, we started moving towards screen times. So what happens in screen time is you need to see the object clearly for reading, and you're not too much worried about this. So we became literally myopic in our work process. That means everything was near. So what does embryologically or optically what happens? When you focus something very closely, your eyeball has to become bigger. Eyeball has a certain size. The size was meant to give a good distance vision and a good reading vision. So when your eyeball needs more work for a reading, your eyeball starts getting elongated. When you start elongated, what happens is you start getting more and more minus power. This is the power of evolution. When all the kids are studying in school, everybody has to have this distance. You are embryologically in a growing phase of your time till you turn age 16, 17, you become more myopic. And then now, as this generation keep increasing, the next generation come, all your baby, all your Alpha, Z, and all those new generation comes, then the dependence on reading becomes more than dependence on seeing somebody at a distance. So you automatically, the eyeball has adjusted to that shape where you are a myopic. By 2050, 1 in 3, or sometimes they say 1 in 2 in Asian population will be wearing glasses. So from an eyesight which is meant to be for all distance, all terrain vision, you suddenly made your eyesight a myopic vision. And myopic vision, if you are a myope, people tell me, oh, just a glass. But having glasses is not true vision. So there are a lot of challenges with vision, your magnification, your magnification factors, your depth of focus, and everything is different. So it is important for us at this point of time to how do we address this population, which is going to be, if you look at your school, uh, your fourth standard or fifth standard photographs, 2 or 3 people will be wearing a glass, in at least he much younger than me, but in my class, maybe 2 people. And he was like the star, like he was the only one who wear a glass. You go and look at your kids and you ask them for a photograph, except for 1 or 2 kid who looks a little abnormal. Everybody wears a glass. So, so what happens today is wearing glass is normal. Not wearing glasses is considered something abnormal. So it's important for us to address few things. One thing which has helped to shrink this eyeball from growing is the power of dopamine. Dopamine is a neurotransmitter. It has, even in your neurology, it has a role in everything. Dopamine uh, is secreted in the tears. We published this work where we took the tears in child who has no myopia, very aggressive myopia, versus somebody who's slowing with the myopic change. The dopamine in the tears were different. So what does dopamine do? It stops the eyeball from becoming elongated, bigger. Because it's becoming bigger, your dopamine has an effect to stop it from becoming myopic. Now, question is, okay, now we know how does dopamine help in a child? A child who's happy, a child who plays, the child who's encouraged to do all the things he likes will always have dopamine.
Right.
Dopamine is that thing which makes you feel good when you get an award. Dopamine is when you play out, you do a gym, you exercise, that increases. The other place for dopamine to increase is sunlight. Push your kids to sunlight. The 7 to 9 sunlight in a myopic child is the best site to make it, because vitamin D, dopamine, and all of them have a multiple action to shrink it. So Singapore national study, they did this is what we refer to. Said that 2 hours of child in sunlight, playing whatever, reduces the amount of uh, myopic progression. But the scientific proof is here because it's dopamine. So a child, see earlier when we were in the school, our prayers and all that was in sunlight.
Yes.
Now all schools have pushed them into an AC room.
Indoors.
I request the teachers to keep it outdoors because your child needs vitamin D. Vitamin D makes your child to think better.
Yeah.
It makes the child to feel better. Vitamin D, there is the amount of children with allergy today. Half the child, asthma, allergy, eye allergies, body, just disappears. If you get a vitamin D, they all have vitamin D deficiencies.
Right.
And sometimes we just don't take it very seriously. The lot of new papers, which is coming out now in the last 4 months in very big journals, like JAMA and all of them, all are now pushing towards the role of vitamin D everywhere.
And it's not as simple as just taking vitamin D supplements. It has to come naturally, organically.
Absolutely.
But sir, more and more schools in the cities don't have access to grounds. They all have this one single building. Every floor is air conditioned. That is also one reason why more allergy, because
Yes.
we are not wired to be in,
breathing the same thing.
correct, it's a circulated air. Plus lack of vitamin D, lack of sunlight. So children are being attacked from all directions.
And low dopamine because low self-esteem.
Right.
See, low self-esteem in a child pushes the child to have a glass, and it pushes him to be aggressive. Then it becomes, the glass becomes thicker and thicker. As the glass becomes thicker and thicker, his esteem, self-esteem drops and drops and drops. So it's a very vicious cycle. So there is scientific proof to it. The schools have to look at a policy. The best time for them to get the vitamin D is not in the mid-afternoon, or it's between the morning. See, imagine all our schools had prayers in the morning. We used to sweat, we used to feel bad, we used to curse people that you're making us, it's a torture chamber. But I didn't see any myopia there.
Right.
And so today you have bigger, we have to change the structure. What is important is, through your medium or through to other scientific medium, these kind of published, we don't want to speak about an anecdotal or a self-claimed, proclaimed fact. I'm talking about what has been published in the best of journals today. These journals are very clear. You expose them to sunlight, make them play. Play increase dopamine, sunlight increase vitamin D.
Yeah.
That's it. See, the best way to play, best way to increase your dopamine today is to run or play, or we all know about it, but it has a big role today.
So one thing I would add to this is the power of movement and increasing dopamine.
Absolutely.
Because evolutionarily, dopamine was the molecule that generates movement.
Absolutely.
So people thought that if you don't have dopamine, you can't move. But it's actually the other way around. If you don't move, you don't have
dopamine.
So that's also a cycle.
So for somebody, it may be you, including you or anybody who's watching, if you are a regular in exercise, stop exercise for 5 days, you lose all motivation in life. You feel that you just want to rest. You don't have any life in it. But minute you do it, the surge of that, I can do something today.
Absolutely.
That is something. So I request the teacher, the school, the people, that whatever you do, do it in the morning, 7 to 10. It's been shown that has the best vitamin D for the entire body.
So rather than scheduling your science, maths classes in the first half, make them run around and move.
Exactly.
And keep the studies in the later half.
Exactly. So what I want to say is, wearing glasses, and this is for the parents and the school and all the public education people, is wearing glasses and handicap. So don't assume that it's normal to wear a glass. So if we don't put an effort, Singapore is doing a lot, China is doing a lot, Vietnam's and Asian communities are doing a lot. All the schools have very strict curriculums on this part. We look at the curriculum change after this work has been done, they all change themselves. So I think they always slow with the progress. I've heard that they're already slowing the progression of this, but Korea is doing a lot on this factor.
So how are they doing it? Are these school education systems keeping in touch with the latest research?
Absolutely.
And why is that not happening in our country?
We are also doing it, but the way is that we have to be very strict in implementing it.
Right.
It's very simple. If you have a sports at 6, or you give an optional to the child, you keep it in the morning. Increase your dopamine. The child's dopamine can make him move heaven and earth. And the dopamine is what child gets you that drive. And today I see the children's, studying is not dopamine. It's stressful.
Yeah.
And you feel low. There's no dopamine at all in this. I'm not saying only dopamine. I like dopamine because I worked on dopamine, but there are a lot of other beautiful neurotransmitters like serotonins and oxytocins and everything else. But I'm just saying this because this has been implicated here.
Yeah. So there is another angle to it, which is on mental health, which is no movement, low dopamine, as you said, low self-esteem. also connected with ADHD and
Yes,
depression.
absolutely.
So this is the holistic side of ophthalmology.
That's one of the reason is that I don't consider myself an ophthalmologist only, but I look at how I can connect the entire holistic angle to it. For example, how dopamine is to myopia, vitamin D is to it. And you very rightly said from your background, the child who has issues with excessive hyperactivities or your other forms of childhood issues,
Inattention.
inattention. We are only okay for. I don't think okay. I take him to a counselor, I take him to a psychiatrist. That's it. Some therapy or medicine. See, until unless you look at it holistically, you're only taking care half of it. The other half has to be taken care by yourself. And see, I know it's a challenge. Even as a parent, I find it challenge to take your child out and all that thing. But I mean, that's the only way out.
To make matters harder, there is now a push from the technology side to make smart AI glasses. And we can see it already. There is virtual reality glasses, augmented reality glasses. So there will be a push to have spectacles on everyone's face. How do we deal with that conversation? What do we tell parents when this happens? Because now kids are having phones, and that is bad enough because they're seeing it from this distance. But what if the phone is on their eye?
Yeah. I heard somebody telling me that, okay, I look at you, I can go to your Instagram page and see who you are. That means you are not allowing your eye to rest.
Right.
And if you're see, we have only limited amount of cells. And the part is that only the corneal cells can regenerate. You have a lot of other cells which is stressful. When it gets stressed, it can't regenerate. You have retinal cells which are macula is the center part of the eye, which is why we are seeing what we are seeing. You're putting stress to all of that. You have a challenge. And recently, there was somebody had from a newspaper. They had said that uh, about sports related injuries. See, the sports related injuries are now they say, okay, do what? I said, you don't, that protections is not about sports injuries. It's about today. I've seen certain kids who come and tell me, well, I was playing badminton till it reached where I did not notice. Then somebody says he was playing cricket and he was getting hit all over the place. And there was somebody, and he had an injury to the eye. When you look at them, it's that your depth of focus you need to, I told you, you need to have a certain amount of accommodation. You need the eye muscles to move in and move out for you to focus in and out. Because of this constant work and all this tremendous amount of thing we do, what's happening is there is a lag. That means the ball comes close to you, the lag is so much that you're not able to appreciate the depth in this spatial field. He thinks it's coming here, but it's already hit him here.
So there is it's like a buffering.
Exactly. Exactly. So it's just not going to affect, these things will affect. A huge amount of this is going to have an impact in your depth, where you need a lot of depth.
Right.
In a profession like you want to be a surgeon, if your depth is not there, then you're not able to judge at what level you're operating through a microscope. And it will affect you. You look at, in fact, I told this to somebody that the accidents happen in the night, not because you're rash or not because you're drunk, because that is the time you're lost in touch. Your accommodative facility is so low that you are not able to judge the distance.
So I want to go a little deeper into the effect of AI glasses, because the way the technology is that the screen will show you details. The screen will show you an Instagram profile. So does that mean that now you are accommodating to such an extent that you are trying to see things on the screen that is on your eye, and will that increase the rate at which the eye damage happens?
See, I would not say damage, but I would definitely say the amount of stress on the eye, especially the muscles, will happen. See, being a clinician and a scientist, I don't want to comment on something where I've not done a work on it. But if you ask me on at a very hypothetical model here, I feel that it will have a lot of impact on the muscles. And I feel like how a new drug comes, like an FDA or India's agencies evaluate it. And then you say whether it's good for you or not. For example, any drug today, you cannot just use it on somebody, even if it's a small drop, until unless we have done a study. That what I would like to request is when you're doing something which is related to your eye or one of your body, if we don't have any papers or to say that's safe or unsafe, then we are using something which we are not at all think, because you're looking at a screen on your glass.
Yeah.
And it's too close. What it does, what it's emitting, we don't know.
Right.
And so I feel that these things has to be really evaluated exactly the same way as you would evaluate a new drug for a dog. A simple lubricating drop a pharma company wants to bring, it has to go through processes.
Phase 3, phase 4 trials.
Exactly. The
Right.
drop has just water and some other stuff. Here, it is something much more.
Yeah. I remember I had once tried on a virtual reality headset where you strap it on and you feel like you are in a completely different world. Within 1 hour, my head felt so heavy and I felt so disoriented. I didn't know what reality was. So I assumed that wearing that all day would have serious consequences.
Absolutely. It will, and I mean, that's how the body is tuned to.
Right.
And there are people who wear it all the time. And he tells them, somebody was telling me, I can choose this, I can choose. Yeah, it's great. But have you looked at how it affects you in your work? Because see, basically it's making your process of aging faster in every format.
Yeah. So I love the format of our conversation that we went from outside to in and we were discussing the lens. Can we go deeper and talk about the retina? So, how does excessive screen time affect the retina? Does it lead to any lasting damage? Are there effects there?
See, we know that um, there's nothing been direct and concrete in that at this point of time. But we are all aware that blue light is not a great light. There are a lot of lenses which came, which was blue blocking, violet blocking lenses, intraocular lenses, because they felt that, of course, the normal human lens has a capacity to block it. But see, what happens is to see a change of what you're doing and to prove it, average time is around 10 to 12 years. And I feel that then that 10 years, I don't want us to sit down here and discuss that something actually caused the damage. So at this point of time, if you feel that the screen time has an impact on the outer layers, assume that you should be careful on the thing. But we don't have a proof on it. But but that's something which we have to be.
Blue blocking screens are very popular, but are you saying that there is not enough concrete evidence that they help?
See, if you block certain wavelength of light, it affects the contrast.
Right.
Okay, so that's the interesting part of optics. You can't. People think, okay, I'll block it. Let me just. If you use a blue blocking glasses, sometimes the contrast drops, and we have to be clear that the contrast is also necessary for our life. The hues, the colors, everything is important. So there is something evidence that these blue filters do help, but how much of it is really working on? Like nothing has been done on. Does none of this have any major studies? We know the effect of this emitting lights, but we don't know. I mean, you can change, the cytokines can change with blue light.
Right.
If the cytokines are immune mechanism of your body, I mean, they are the messengers of immune mechanism. That means if I use different wavelengths of light, the cytokines itself can behave differently. That means you're changing the immunology of the eye.
And we still don't know exactly how.
We don't know the how. In a theoretical model, we believe that it affects the cell's response. Maybe there may be cell death. When it's a cell death, the cells secrete whatever is inside. And when it secretes it inside, that is where the whole cytokines come. And this is the way it should be working.
Right. Since we're on this topic, I also want to talk about red light, because red light therapy, red light glasses, they are also popular. Do they have any role to play? Have you come across them?
Yeah, of course. See, we use a certain amount of photomodulation. Certain photomodulation is using light, which will improve the cell, the life. It also has a role in dryness using the thing. It also has some role in retinal functions also. Red light has role in people use it for different parts of the body.
Right.
And red light has basically is a photomodulation
Okay.
concept. We work on the blood vessels and all that stuff. And also, we're using some part of it light to, simulate people who have issues with your depth of focus or accommodation.
Okay.
So we're also using the light therapy to work on this.
That. I want to now take the conversation to one of the controversial areas where we have discussions slash arguments with my ophthalmology colleagues, which is on LASIK. And there is a popular line that gets thrown around that why don't ophthalmologists do LASIK on themselves? Can you shed some light on that?
To start with, I have many ophthalmologists whom I operated in my own hospital.
Okay.
And the second question is, have you operated on your own family members? My wife is one, and they've been happy last 20 years. And the first question is, when people talk about safety of any procedure, the first thing we ask is, how long has it stood the test of time? And we celebrate close to 30 years now. And in 30 years, of course, I mean, like any other surgeries, there are few which may have not gone well. I mean, as doctors, I mean, we have to be very clear in the beginning itself. You are doing what the technology can offer. Your body's reaction to it is something which nobody can help. But over and over, uh, the new introduction to new technologies and other things have reached the stage today where we have reached the stage where we can achieve the most finest way of how to give you the quality of vision like never seen before. Now, if people ask me, can I see like a 4D camera? I said, yeah, I don't know what 4D is. I has got much better pixels, but you can see it maybe better than that. And but the whole thing is that everybody is not suitable. There are many ophthalmologists we have denied getting the surgery done because you have different powers. You have very small powers. You have issues with the eye. You have dryness and all those stuff. We don't do it. But otherwise, as far as I know, now that myth is kind of put to rest.
Put to rest. So you can go for a LASIK surgery. It is safe.
Yes, of course. But always go with the best of technologies. This is one place where you should be very clear about looking at an investment rather than spending, because there are times you may want to do it at the old technologies or something. So I think here you look at it like I would do the best, whatever is best in today's context.
Okay.
And I would not be hesitant to even invest a little more, not rather than trying to look at only the price as main one.
So could you name one or two parameters that somebody should look at to decide this?
One is one of the biggest parameters today is like how you choose a particular restaurant or hotel. You look at, okay, is this place good? Is it safe? Is it does it have the standards to do it? Has this people been doing it for a long time, or they're just new into the market? How is the track record over the last 15, 20 years? What machines are they using? The machines which is the best in the world. And you type, say, for example, you have a Silk, Smile, Etos, Innovice. All this, you Google it, you'll see that they're all this. Or you have something which you never heard of. And look at their doctors, see that they have experience in doing it, or they've been doing it for a long time. Because there's nothing to beat experience. It's not the machines there. It's your hand and skill, and what the skill and hand that makes the machine to work in your favor.
Right.
So I think that is the most important thing. And of course, they will look at all the diagnostics. They will look at what are you suitable, not suitable, and always pick a doctor who is very transparent about everything which can go wrong also, right? So people ask me, what is the main thing which differentiates the best versus the worst, is about how transparent are you when you talk to them about a technology, because nobody can be God here, and everybody can give you whatever is the best. Nobody wants to harm you. If something has not gone well, it's not because they wanted to harm you. It's just that it's your body reacted. And today's even that can be sorted out.
Okay. So every field in medicine is evolving so fast. There are so many new things that are coming up. So what is there in ophthalmology that is really exciting, cutting edge, that you are very excited about?
Uh, being a very optimistic scientist, I would say that how we are bringing our research to your clinic. And that's what excites me the most. And ophthalmology has always been the forefront in bringing technologies and a new regenerative, reparative medicine which others use. The most successful uh, stem cell, everybody talks about stem cell, right? The most successful stem cell use is ophthalmology. A stem cell can be used in your clinic. You don't even need an institute. We have ocular surface diseases. The gene therapy, the costliest injection, one of the costliest injection in the world for reversal of night blindness, Luxturna, which I don't know the exact amount, but they say it between 9 to 11 crores. It's not still available in India, is from ophthalmology, which commercially available. I'm talking about, not the research. Right. The technologies changes at the fastest rate today. So what we are working on is, one is how do we repair the cells which cannot regrow. For to look at the clarity of the eye, we need those corneal endothelial cells. They are like a pump which makes your cornea clear. So we have able to generate the cells from the peripheral blood. We call it iPSC stem cells. That's a big success. We are now working on the animal model. Hopefully this year or next year we'll bring it out. We build the world's first biomarker kit where I can take the tears, I can look at all the cytokines, the immunological aspect of it. And this is a big leap from, it's like saying in the past, people didn't know how much sugar you have. Right? For that, you have to take a blood, send it to the lab. That guy gives you a report after a day or two. Imagine the
Glucometer.
Just to, we created the immunological glucometer to the eye, and there's the only one in the world today. Nobody, including the best of our competitors, are looking at it, but we already in our clinic, and we want to bring it to the public domain. So it can pick up immunology from anywhere. That's the second. That's a predictor marker. Well, how does it help? It will help you to decide what drug should I use tomorrow. Third is, how do you repurpose the drugs and bring it to specific to ophthalmology? For example, the role of trehalose I mentioned. It's autophagy inducers, makes the cells to die, cells to survive and to become strong. The role of cyclosporin, the role of, we use the anti-VEGF to the eye, the same which was used for cancer, the role of how we're bringing in vitamin D to the clinic, the resveratrol, which is, I feel, a great drug for many things, including dry eye, regeneration, and other things. Curcumin for anti-inflammatory effect. What we are trying to do is, how do you bring that drug and repurpose it to your clinical use, and what proof do you give them? Proof is important because today we are becoming more of eminence-based medicine, not evidence-based. Eminence is like you say it, I say it, so everybody agrees. Evidence is when you have proof and proof and proof of everything. So we are trying to bring it to that level. Right. We're working extensively in repairing the genes, both in the eye and many other parts of the body. I did mention to you in the recent conversation that one of the areas of work and outside the body is hemophilia. Right. We are working on muscular dystrophy. A very nice post I had in my social media about a mouse which was given a gene therapy, which we had mouse, genetically modified mouse, which has muscular dystrophy, which couldn't run. And we had certain mouse which had dystrophy, but we used the gene therapy and we put them on a small treadmill. And the mouse where you put the genes were running like Usain Bolts, and the one which was not were just struggling. So that means that there is proof, and we are working on at least 3 or 4 diseases of blindness in the eye, where we are trying to make them to see, and the costing will be many zeros less. And that means that we want to make it, start the trials here, and bring it to our patients so that we can choose the amount at the lowest, whatever the lowest is. And then we want to bring in the whole concept of this whole myopia work, and where we want to bring in a dopamine based diagnostics where you're able to pick up early from the tears. Tears is a great source of early detection. We are working on tears to see if we can detect early cancers, because whatever protein is secreted, you know, we can pick up. The people have worked on breast cancers. This can pick up earlier than your mammographies. We want to work on tau proteins from Alzheimer's, dementias, and the role of Parkinson. So, what I feel is when we talk about uh, the future, but in whichever medium of uh, uh, business ecosystem you see or healthcare, AI is the only thing which we are bringing AI into this game. So what I'm trying to say is there is many other ways how you can fast forward your healthcare system without. I not that I don't like AI. We have a lot of AI, but I wanted to use talking to you without an AI, because biomarkers, regenerative medicines, reparative medicines, we are looking at the repurposing of these drugs, how the nutraceuticals has an impact on the health. See, we have not looked at the diet. You know, I forgot to tell you, in a child or a young adult who has a lot of dryness, one of the things which has helped many people is cutting down carbs and sugars. Wow. Because when you cut down carbs and sugars, the first thing which goes from your tears is the immune profile changes. We published this work in Frontiers of Nutrition. It's a published work which talks clearly about the role of reducing. That means a child who has very high, who's eating a lot of sugars, may have a low level of dopamine, because sugar doesn't gives you an artificial surge, but it's not the dopamine surge. I've just given hypothetical one. So sugars, high carbs have a huge implication in your dry eye, in many aspects of dry eye. It's not just to help you to reduce your sugars. And we've been talking about it to a lot of our patients that Alzheimer's and all these things, dementia, are going to be the third diabetes 3. People call it as the third form of diabetes, because these diseases are driven by sugar. Yeah. So if you're Alzheimer's, Parkinson, dementia, which will have 30%, 35% of a population are going to face it, is a worse disease to get. If I think one thing which can have a preventive role is how less carbs we eat and how less sugars we cut down. So people have all of us have that, speaking for myself also, we believe that the the diabetes is only one which is sugar driven. I can start from dry eye, myopia, retinal conditions, blood pipe hypertension. You took at muscular dystrophy. If you reduce the carbs and sugars, you reduce a lot of immune changes. And we have published this work very beautifully. Our late chairman, Dr. Bhujan Shetty, was a great proponent of food as medicine. Right. And he championed this a lot. And he never spoke about diabetes only. He spoke about many diseases.
I think one of the disservice that we have done in our medical colleges is to not understand the depth of diabetes. So in diabetes, because it's basically carbohydrate metabolism going wrong, it is more of an inflammatory state.
Exactly.
Than anything else. And every part of the body will get affected. They used to say that the eyes are the window to the soul. So could we now say that the eyes can be the window to all diseases in the body?
Absolutely. I have no doubt. See, for example, In my recent research, we did pick up the tau proteins. We were able to correlate to the deposits on your MRI, and it picked up. It was quite nice. We should be able to look at the other biomarkers. We call it the biomarkers because it is a marker for something which is biologically new.
Yeah.
So when we are looking at eye, because it's such a connected organ, right? And because there are tears or secretions or multiple things which get secreted over it, it does picked up, and God has kept it very privileged.
Right.
Because it kept it privileged because for everything what we do, we need that organ.
So,
There are people living without legs or hands, or they are on wheelchairs, but they can function, they can run companies because their eye is functioning well.
Yeah.
But,
That is,
yeah,
I don't think a lot of people realize, but our eyes are the only external sense organ that is an extension of the brain.
Yeah.
It's not another organ connected to the brain. It is the brain.
it is the brain. And see, just 2 days back, we saw somebody with retinal hemorrhages, and we sent him, and he was diagnosed as leukemia. He didn't have any symptoms of it. So we have people coming with discs of the nerve becomes swollen up, and we see the pressures in the brain has gone up to 600, 700 manometers of mercury. So this is where we have to be very careful, that we have to the lot of early signs gets picked up. So, and also important that eye examination today is not getting a glass checked. The glass check is for the optical examination. There's a two different thing. And eye examination is different and optical examination is different. So don't expect that optical examination done in 15 minutes is the complete eye examination. So doctors can pick up a lot about your general health through your eyes.
So learning to use a fundoscope properly should be a non-negotiable skill.
Absolutely.
Every medical student, every MBBS student should know how to do this.
Absolutely.
Sir, in holistic medicine, there is a way of testing called iridology. Now, this was debunked to be pseudoscientific. But since we are so deep into this discussion, I want to ask you if there can be any meaning to it, which is basically that the iris can have certain marks, you can pick up certain things from studying the iris that can allow us to diagnose diseases, give us more information.
Now I'll bring the AI picture to it.
Yeah.
For it to work, you have to have minimum around 8,000-10,000 people, and you have to have serial follow-ups over them over time. And that's when the AI will pick up. Is there a link between certain types of iris scripts or iris function with a particular disease? But the retinal images, the Buell image studies have shown, can pick up early cardiac changes.
Right.
They can pick up early diabetic changes. The vascular changes in the eye in diabetic can pick up how good is your kidney.
Yeah.
So there is, in that zone we already have. But iris thing, if somebody has to do it, they have to do it with an AI based.
Yeah. One of the things that really interests me about biology is how our entire body is connected. So when we are talking of diabetes and heart disease, we are talking of microvessels. So there are two areas in the body where microvessels can get affected and we can pick it up early. One of them is loss of erection in men, which very often they don't talk about for years. And then that is like a very early marker of potential heart disease, potential diabetes. And the second one is the microvasculature in the retina. So these things of how one area of the body can predict another area should be talked about more often.
Absolutely. See, for example, we have a lot of stigma to talk about certain things. We consider it as a taboo, and we try to hide it. For example, we get people with, like how you have heart attack, we have people who come to us with acute loss of vision suddenly, and we ask them, have you taken any tablets? They never tell anything. Then when we go very deep, one of the things which has a link to the eye is sildenafil citrate. Now, second thing which we get now is these Ozempic and weight lowering drugs. We have published reports of people developing ischemic optic neuropathy and losing sight because Ozempic does have some link to the blood vessels of the eye. And this is again published in the very good journals. And they don't talk about it. Sleep apnea has a huge impact on the vasculatures. So what I'm trying to say is eye has linked to many things. This, we'll have, as soon as this Ozempic kind of drug will be launched here, we'll have a lot of people we have to educate them that these drugs have side effect which is just not in your physical body. It can be on one of your senses. And one of the first reports of blindness is caused by Ozempic.
Right. I didn't know this, that Ozempic can cause blindness. Now I'll go and read about it, but I'm curious about the pathology. How can it?
Vasculature.
Wow.
It changes the vasculature, the blood flow,
Okay.
and small vessels.
Yeah, you're right. Nobody talks about this.
Yes.
I want.
Same is with the sildenafil also.
So sildenafil is Viagra for
Yeah,
everybody, and you're saying that that can affect the vasculature in the leg.
absolutely.
Amazing.
That's why, in the early part of side effects, people were complaining that they have different light hues, which they feel that blue light, some lights perception changes because it's changing the blood supply, and that would affect some part of the supply to the cone's photoreceptors.
Right. There are some interesting cases that come to my clinic with eye problems, and one of them is functional blindness. So patients who claim that they can't see, and it is actually because of a psychological distress. And a lot of these patients come from interior villages, and they can get better because some Baba does some jari buti and gets them to be, feeling better. We don't talk about the importance of faith in our medical practice. Our evidence-based medicine seems to be going away from that. But do you see any sort of integration that we can also use the power of faith in our practices?
See, I always see, if you look at the best doctors in this country, starting with you as a child, we as a child, as physician, what were they giving you more than medicine? That bonding with it now. They'll play with you, or they'll give you a chocolate, or they'll do something, So the faith in healing is a very, very important aspect of medicine. We started looking at, we never look at it holistically now. You come with the particular redness, I give you what medicine for the redness. I don't look at whether you spend of course, time is a factor, whether you spend this much of time. So our medicine has to be today, apart from the faith, you all have to wear a hat of Sherlock Holmes. It's not textbooks anymore. They say, oh, doctors misdiagnosed this. My doctors did not give me a right opinion. I want to tell the viewers that medicine, what we studied in a book, is completely different than what you come to us with. Somebody comes with some vague twitch somewhere else. For the twitch, you give him some medicine. He doesn't get better. After 1 year, he comes with a lung metastasis. And he said, you missed there is no relationship between a twitch in your eye to a lung metastasis. Textbook don't teach us. Even today's students don't read it. So it is important that you have to give us all that which you feel. Suddenly, if you had said that I have lost 20 kgs weight, I know there is something there. But many times you feel, how does a weight loss has to do with twitch? So it is important that you give us everything, because we are sitting there as not doctors anymore, like you're sitting like a Sherlock Holmes. You have to figure out from top to bottom your feel, your twitch, whether you're shaking your right hand or left hand, whether you're if you look at Sherlock Holmes books, you will know that whether you're putting more pressure on your left shoe or the right shoe.
Yeah.
That means that, as a neurologist, you could be you could have a different type of a gait.
Yeah.
So today's context is that you have not doctors, but you're wearing one more hat. In that hat, the most important ingredient is how do you infuse faith?
Yeah.
And you have to. So, for the example, the faith what a spiritual person gives is the faith of transmission of his power through faith. That means I give you this jadibhuti, which is exactly what you would have given, but without your faith, you would have thought of giving micronutrients, but you said this may not work. But he may give the same micronutrients, say that it works well.
Yeah.
It works well. Want to say about there's a beautiful article in National Geographic 7-8 years back. The title of it is Faith and Healing, and a beautiful one. In that, there is a one aspect of the article talks about in the World War II they did an experiment that they ran out of morphine and they had pain. People had pain. So what the doctor did was he said, "Let's put a sticker of morphine," and 10 soldiers got morphine. 10 of them got a sticker with the morphine. And but that morphine sticker was shown before you took the needle and injected. The people had the same amount of pain reduction because the belief was not with the drug, the belief was with the morphine which was written on that cover. So then they did an experiment that through this mouse and models, and they found that the pathways which works to reduce the pain
Yeah.
when you see a painkiller is something similar to what the painkiller is actually doing. So, as doctors, as healers, as physicians, it's very important to we have to bring in faith.
Yeah.
And most important thing, I would end this part of the faith conversation by saying that we should never ever tell a patient that this is the end road. He may come to you with absolutely no vision, or he may come with absolutely no function of his limb. I tell my patient, give me a few years, stem cell will cure it. Give me a few years, gene therapy will cure it. Give me a few years, something else will cure it. And I'm not telling a lie, because in 15 years back, or 20 years back when I started, I used to tell, give me a few years, I'll get you a gene therapy. That patient comes to me and said, "Doc, are you ready?" I said, "Give me a year, it will be done."
Wow.
That means it took time. It took time for 20 years, 22 years. And, but if I told him at that point of time that that's an end of it, he said, "See, I finished my uh, BA honors, I did my LLB, I did it, assuming that I am not going to be completely blind all my life."
Yeah.
And every 3 or 4 years used to come and tell me that faith that I kept reading more and more and more.
Yeah.
And I told him, you come to a time where I can give you a date when this gene therapy, and it will be done in our own system.
Yeah.
And that's, you asked me, that is what gives that dopamine serotonin surge, that you are bringing that faith to reality, which probably, if you're just same thing with, muscular dystrophies are the worst thing to get.
Absolutely.
Muscular dystrophies, you're born healthy. By the second
Decade.
decade, you become a vegetable. The parents never realize that a person who's playing basketball can be bedridden for the next 40 years of his life. And if you have two kids and both of them have it, I have families where their two kids, both bedridden and elderly patients. I tell them also, I showed that video of the mouse running. I said, today is the mouse, tomorrow it's you. And they said, okay, then when? I said, shortly, we're going to start the human trials. And see, that is what the faith we had to do. Saying for anything that this is an end road in today's context, oh, this is all we can do, is completely wrong. You may have stroke, you may have paralysis, you may have everything. The medicine is saying so fast. Even when I'm talking to you here, there may be 10 different experiments will be done and shown that something happens. And today, the transition from a thought process to reality is closer than 5 to 6 years. When we started, it took, but from here to here, it took 15, 18, 20 years.
Right. Absolutely. It is so unfair that words like hope and faith have all been co-opted by only religions
Absolutely.
and quacks. And somehow, even using these words as qualified doctors seems to be uncomfortable. Why are you talking about hope and faith? But this is what I like about neuroscience, which is neuroscience is sort of bridging that gap.
Absolutely.
Because when we read about endorphins and we read about cannabinoid receptors and opioid receptors and how these chemicals actually change
Absolutely.
when you go to a temple or when you go to pray, then you realize the connection and how pain can reduce when you do these things. So these are probably skills that maybe doctors need to learn more than anybody else.
Absolutely. So I picked up a very interesting line from that National Geographic book. It's called Theaters of Healing. So theaters of healing is very important because when you spoke about different kind of people, non-professionals treating people, how do they treat? They don't treat with drugs. They treat with faith. They have a theater for like, you have something, you talk to them, the way you talk in nice. See, we have to develop. We have clinics, but we have to develop that concept of theaters of healings where you bring in that concepts which improves when you go out, your dopamine improves, your serotonin, your receptors behave, and all these things are there. Then after that, whatever drug you give will start working.
There's an interesting study on chronic low backache where earlier people thought that all chronic low backache was because of a physical pressing of a nerve, and of course every low backache needs surgery. But there was a series of studies done on the placebo effect of different medications, and they found that backache reduced when people were given a pain medicine or they were given a placebo saying it was pain medicine. It reduced more if they were given an injection. It reduced even if the injection was not a pain medicine. It reduced even more if the injection had a bright color. And when a sham surgery was done, when somebody was put under anesthesia, opened and closed, and nothing was touched, their pain disappeared for a few months. So there is definitely a lot of role of belief systems when it comes to these chronic symptoms.
Absolutely, and again, going forward to what you just said, it's a very interesting paper which was published in one of very high impact journals on. I think it's in the Journal of Pain. And so, it's a very impact one.
Yeah.
What they did was, when a particular medicine was given, the facial I'm a doctor, I'm giving you medicine. There's a difference in giving with this way or this way. Okay, so this way and smiling were graded by facial recognition. Okay, and then the same medicines were given. What they found was the kind of frowny way of giving a medicine versus a much more positive way of giving a medicine had a different impact on the disease. And it's a beautiful article, and he was also, they showed how they graded on the facial frown and all that things. It was a particular grading. So what does it say? The way you prescribe, your body language of writing a medicine to you, saying that this is what I'm giving, this is how it works, this will work,
Right.
has a different body's chemical response
Right.
compared to tearing a prescription and this will work. So see how much we are lacking in our system.
Right.
So in ancient medicines, we call it as healers. No, healing and curing are two different things. Is what we're doing is curing. Healing is holistically looking at everything, like you mentioned. They used to feel you, they used to talk to you, they used to measure it, mean it. So what happens is that has more of recovery proteins being secreted rather than just prescribing and giving it to somebody.
Yeah.
And these are all scientific proof, which proves what we already know, but sometimes we will not follow.
I once met a very senior physician. He was practicing at the age of 85 in Bombay, and he had a very good practice, but he would still personally take the blood pressure of every patient. And I had asked him that, you have a receptionist outside, you have nurses, they can take it. And he said that the patients are not coming to me for the tablet. The patients are coming to me so that I can
Absolutely.
be with them.
This is the theater of healing.
Right. Just the act of putting a hand on their shoulder,
Absolutely.
feeling their pulse.
Exactly. We somehow, in this whole new dimension of new drugs, new treatment, new skill, new machines, AI, we have somehow forgotten to transmit that teaching to the generation. We have to somehow make them feel that this is an integral part of science. That's why I did bring out all that papers, which clearly explains about why, your physical body language has an impact on the medicines you take. You can ask your patients, if you're very confident about the procedure, you say, this procedure, I'll do it for you, will do very well. He will take the date for surgery. When you are, well, I think so. When you are in doubt,
Yeah.
that means you lost the game.
Yeah. I have found a very powerful line, which is when you're explaining the risk of a medicine or something to a patient, if you say that if this was my dad or my mom, I would give this.
That
The
works very well.
impact is so much more because they connect at an emotional level now.
Absolutely. Absolutely. And that's why our hospital's tagline is, your faith shall heal you. That means your faith in not just the doctor, in the process, in the medicines, and in faith in everything else. So what happens is that belief is enough to risk anything.
Yeah.
Because you and me can't guarantee anything. We are as helpless as anybody else. Only thing, we have skill where we can use it to the best of our ability.
Yeah. I want to talk about holistic medicine. And here I'm including every kind of medical practice that has existed over the last 5,000 years. Different groups of people have tried different ways of healing, of making people feel better. Now, with evidence-based medicine, a lot of the attention has gone into the molecular systems, right? How does something work at a molecular level, at a cellular level? And that has brought this amazing revolution of medicines and technology. But there is a lot in holistic medicine about the soft skills. So it almost feels like we have replaced all of holistic medicine with this new cellular medicine. So we should definitely bring back that. We should bring back the soft skills, the way of communication. But are there things in, say, Ayurvedic medicine for the eye, are there things that is valuable that has sort of come back or has any role to play in evidence-based medicine?
Absolutely. Like I'm being a scientist and clinician, I never deny the power of alternative medicines. But alternative medicines should be tested, because today's population cannot be told that this is how it should work and this you have to use it and finish it. Today's medicine is about proof.
Right.
So what I would really, this is what I've been asking and requesting all the other forms of medicine is, you bring in proof. For example, according to me, the medicine of Ayurveda, Unani, homeopathy, everything is about immunity. And they work on immunity in a different pathways compared to the way our steroids and immunomodulators work. Most of them improve the immunity. For example, in many forms of medicine, fasting is a medicine, right? What does fasting do? It improves the autophagy of your body for that day. In the beginning of my talk, what does autophagy do? Autophagy helps to clean the dead cells. If you've not eaten food, your body is not stressed about converting your glucose, fructose, and everything. Your body can take care of the dead cells. So, what we know from today is fasting helps to improve your autophagy. Fasting is used even in cancers, every form of medicine. Right. What does Ayurveda talk? Ayurveda has a lot of dietary regulations. They stop many things. They start, they look at certain foods which bring more. The homeopathy is all about improving the immunity. So we have to look at different forms of medicine to have an integration into how it works for a particular patient. And Ayurveda's treatment is based on the type of individual, the Vata, Pitta. So they look at what kind of a person are you, and then they start the treatment. So what is important is every form of medicine has very, very strong grounds, very strong foundation. But today's thing needs a molecular data.
Yes.
For example, if you give this, that's the reason we use studies like what happens when you stop carbohydrates and sugar, and we saw the change in the immune system.
Right.
If tomorrow, if say Ayurveda, one of these medicines, say that you stop this, you stop 1, 2, 3, and the person improves,
Right.
we have a proof to it.
Yes.
So it is important that we have to have a proof to all these forms of medicine, which is, I think, the medicines which taught the modern medicine. These medicines are the teachers of today's medicine, but somewhere I feel we might have got too carried away by its own strength and just ignored the holistic part of it.
Because some days I feel this whole conflict seems very unnecessary, because it seems that we are all on the same team of wanting to help people. And the unfortunate thing about alternative medicine is that they are not put through as rigorous studies.
Absolutely.
Right? And so the level of belief that I have in a new Ayurvedic medicine is very less.
Yes.
Because I know for a fact that people have just gone and put up anything as a medicine and called it herbal medicine because they don't have to prove it.
Herbalness in the medicine has to be tested.
Yes.
And I would like to say, I mean, this word was used during COVID. We are all in different boats, but in a same storm. The disease is your storm, but each person is using his own boat to maneuver it. And only thing is, if you bring in more proof, you can't say that I can't give you proof. The proof is whether you're healing or you're not healing. That doesn't work in 2025. You have to say whether it's worked or not. And I feel a lot of Ayurveda, a lot of these other alternative medicines can be fine-tuned. A lot of them can be in synchronized with your treatments.
Yes.
Like, for example, having one of the classic turnover is curcumin. Curcumin is used in food. It's used in the many alternate. Now, a lot of rheumatologists use curcumin as an oral supplement. Resveratrol has been used. Resveratrol has been used in grapes and multiple other things. So it means that we are also borrowing a lot of things from different forms of medicine. But here you are working towards a molecular pathway and signaling pathway. How a signaling pathway can work to improve your health.
Yeah. Eventually, every single chemical, whether it's used in Ayurveda or homeopathy, ultimately it comes down to a chemical.
Absolutely.
And that in association with evidence base will give us a full picture.
Absolutely. Whatever medicines you follow, whatever medicine has been approved, we have to be very clear that we have to put effort to bring its real proof.
Yes.
Without proof, it's not right to use something, whether it's on your hair or you take orally, because we don't know. I mean, we just can't believe in it. But what I feel the power of a today modern English medicine, we call English medicine, is that you look at the back, you have every component of it written.
Right.
And every single thing written, and every single thing you can Google it, it will tell you which pathway it works and why it works. So unless we get that kind of a power, there'll always be doubts about it. I have no doubt that it is not going to work. I'm sure it's going to work. But people today want certain amount of proof.
Yeah. And I think that's fair, sir. I think it's fair to demand that, because if there is no accountability, anyone can scam anybody.
And you can bring in anything you want.
Yes. So the unfortunate thing about alternative medicine is that there are alternative medicine practitioners who are bringing their movement down.
Exactly.
Yeah.
Exactly. And I want to say that try to work on getting the right proof. There are enough researchers in this world who are ready to get you that proof.
So I think in this conversation, we have touched upon every aspect of health. We've started with the eye, but we have gone all the way to faith and spirituality and back. Thank you so much for being a part of this. Thank you, sir.
Thank you.